especially thank Ms. Noss and UPS, not only for your important presence in the Commonwealth of Kentucky, but for all of the great work that UPS has done on vaccine delivery, delivering over 93 million doses to more than 46 countries. Our thanks to you, and it's a reminder of the very valuable contributions of the private sector in the fight against COVID-19, not just the pharmaceutical industry, but UPS as another great example. I do want to focus on the World Health Organization issue for any of our witnesses. The House-China Task Force, on which I was proud to serve, found that the WHO was a co-conspirator in covering up the COVID-19 outbreak in Wuhan, parroting the CCP propaganda and disinformation leading to millions of deaths worldwide. Last year, Secretary Pompeo stated that the leadership of the WHO was corrupt and that the pandemic was a direct result of the Chinese Communist Party covering up and doing it with a complicit World Health Organization. Now, Mr. Sherman has seemed to excuse the WHO from this status as a co-conspirator on the grounds that they don't have an intelligence arm. I would simply submit that any organization, any international body that disregards the untrustworthiness of the CCP and blindly accepts their propaganda is either incompetent or more likely a participant in the malfeasance. We have seen the WHO fold to pressure by the CCP before.
Will the gentleman yield?
If I could just get this question out, Mr. Sherman, what reforms do you all think are necessary at the WHO? Because I think, Mr. Sherman, this gets at what we all should be focused on, and that is, what reforms do you think are necessary at the WHO to make sure a cover-up like the coronavirus never happens again? Any of the witnesses?
I would put forward, thank you for the great question, Ranking Member. I would put forward several, and I would also commend to you the Council on Foreign Relations, where I work, recently convened a task force to look at these very issues. The thing I would point out with regard to the World Health Organization and China is, in terms of the assessment in our report, China was clearly, or the World Health Organization rather, was clearly too credulous of the claims China was making, and they were a week late in declaring a public health emergency of international concern. The World Health Organization is a member state organization. Its tendency to defer to countries in crisis is not particular to China, and we saw similar patterns in West Africa and the Democratic Republic of Congo. What we need is threefold. First is a surveillance system, hospital-based sentinel surveillance system that is not dependent on the transparency and self-reporting of directly affected member states. We need a reform to the emergency committee that forms as part of the process of declaring a public health emergency, so that is more transparent and rigorous. And last, we need more clarity as to what the international health regulations require in terms of information sharing, because that lack of clarity has led to numerous nations, not China, just China, to be slow to turn over information.
Well, on a related point, I am worried about China's vaccine diplomacy, as many of the witnesses also pointed out. And it's, I think, part of China's Belt and Road Initiative. And I think I think their vaccine distribution efforts with substandard vaccines, when they haven't even addressed their own population, could be have a very negative impact. My question is, what is the effect on the fight against the virus if China engages in vaccine diplomacy with vaccines developed in secret and not accepted by the larger international community? And how are we going to make sure that the WHO doesn't give their stamp of approval on a vaccine we do not know is safe?
Let me try this, Congressman. A couple of things. First of all, I think it's incredibly important that these vaccines go through a regulatory approval, kind of the same kind of rigorousness of the European Medicine Agency, the US FDA. And I have encouraged countries around the world to not just take clinical data from a study that might have been published in a journal, but to make sure that these vaccines are rigorously evaluated. WHO has a list of regulatory agencies that should be doing a careful evaluation of these vaccines. I think that's important. I worry a lot about the vaccines that we've seen so far from China. They're clearly much lower efficacy. I don't know how safe they are. I suspect they're safe, but suspect is not evidence. So we need a lot more openness and data. And I have encouraged countries to make sure that these things go through a proper regulatory evaluation.
Dean, thank you very much for your testimony. I yield back.
Thank